Understanding Asthma: Causes, Symptoms, and Triggers, your guide to understanding and managing asthma. Asthma can feel overwhelming, but understanding about it is the first step to breathing easier. This video breaks down everything you need to know about asthma, from its causes and symptoms to effective management strategies, empowering you to live a full and active life. Asthma is a chronic inflammatory disease that affects the airways of your lungs. Think of it as a condition where your airways become extra sensitive and reactive. This sensitivity leads to swelling and hyperresponsiveness, meaning your airways constrict more easily than normal. This constriction narrows the airways, making it harder for air to flow in and out of your lungs. The result? Those familiar asthma symptoms: wheezing, coughing, chest tightness, and shortness of breath. Asthma can affect people of all ages, and it often begins in childhood. While there's currently no cure for asthma, it's a highly manageable condition. With the right knowledge, tools, and a proactive approach, you can control your asthma and live a normal, healthy life. To truly understand asthma, let's take a quick tour of your respiratory system. This will help you visualize how asthma affects your breathing. First, air enters your body through your nasal cavity. Here, it's warmed, moistened, and filtered to remove dust and other particles. Next, the air travels down your trachea, also known as your windpipe. The trachea connects your throat to your lungs and branches into two main tubes called bronchi. The bronchi further divide into smaller and smaller tubes called bronchioles, carrying air deeper into your lungs. At the end of these bronchioles are tiny air sacs called alveoli. These alveoli are where the magic happens. Oxygen from the air you breathe passes into your bloodstream, and carbon dioxide from your blood is released into the alveoli to be exhaled. In asthma, inflammation and constriction obstruct airflow throughout this system, making it difficult to breathe. Asthma isn't caused by a single factor. It's a multifaceted condition influenced by a combination of genetic, environmental, and lifestyle factors. Let's break down each of these components. Asthma often runs in families, suggesting a strong genetic component. If your parents or siblings have asthma, you're more likely to develop it yourself. Scientists have identified several genetic markers associated with asthma. These markers can affect things like your immune system's response to allergens and the hyperresponsiveness of your airways. For example, some genes influence how your immune system reacts to common allergens like pollen or dust mites. Other genes can make your airways more prone to constricting when exposed to triggers. Your environment plays a significant role in the development and severity of asthma. Exposure to various allergens, pollutants, and infections can trigger asthma symptoms. Allergens. These are substances that trigger an allergic reaction in your body. Common allergens that can worsen asthma include pollen. Seasonal allergies caused by pollen from trees, grasses, and weeds can significantly worsen asthma symptoms. Dust mites. These microscopic creatures live in bedding, carpets, and upholstery. Their droppings are a common trigger for allergic reactions and asthma. Pet dander. Proteins found in the skin, urine, and saliva of pets like cats and dogs can cause allergic reactions and trigger asthma symptoms. Air pollution. Poor air quality can irritate your airways and trigger asthma attacks. Key culprits include tobacco smoke, a major risk factor for asthma, both for smokers and those exposed to secondhand smoke. It irritates the airways and worsens asthma symptoms. Vehicle emissions. Exhaust fumes from cars, trucks, and buses contain pollutants that can irritate the airways and trigger asthma attacks. Industrial emissions. Factories and other industrial facilities release pollutants into the air, contributing to poor air quality and triggering asthma symptoms. Respiratory infections. Viral infections can inflame and irritate the airways, making them more susceptible to asthma triggers. Common culprits include rhinovirus. The common cold is a frequent trigger for asthma exacerbations, especially in children. Respiratory syncytial virus, RSV. This virus can cause severe respiratory infections in infants and young children, increasing their risk of developing asthma later in life. Your lifestyle choices can also impact your risk of developing asthma and the severity of your symptoms. Key lifestyle factors include obesity. Excess weight can put pressure on your lungs and increase inflammation throughout your body, making you more susceptible to asthma. Physical inactivity. A sedentary lifestyle can weaken your respiratory muscles and reduce your overall lung function, making it harder to breathe. Smoking. Smoking damages your lung tissue, increases inflammation, and makes you more vulnerable to respiratory infections, all of which can worsen asthma. Asthma symptoms can vary from person to person and can range from mild to severe. Recognizing these symptoms is crucial for early diagnosis and effective management. Wheezing, a high-pitched whistling sound that occurs when you breathe, especially when exhaling. It's caused by air being forced through narrowed airways. Coughing, a frequent cough, especially at night or during physical activity. It can be dry or produce mucus. Shortness of breath, difficulty breathing or feeling like you can't get enough air. You may feel like you're gasping for breath or struggling to breathe deeply. Chest tightness, a feeling of constriction or pressure in your chest. It can feel like your chest is being squeezed or that you have a heavy weight on your chest. It's important to remember that the intensity and frequency of these symptoms can vary. Some people may experience mild symptoms only occasionally, while others may have more severe and persistent symptoms. Asthma triggers are factors that can cause or worsen your asthma symptoms. Identifying and avoiding your specific triggers is a key part of managing your asthma. As mentioned earlier, allergens can trigger asthma symptoms in many people. Here's how to minimize your exposure. Pollen. During pollen season, stay indoors as much as possible. Keep your windows closed and use air purifiers to filter pollen from the air. Dust. Mites. Wash your bedding in hot water at least once a week. Use dust-proof covers on your mattresses and pillows, and vacuum regularly. Pet dander. If you're allergic to pet dander, limit your exposure to pets. If you have pets, keep them out of your bedroom and wash your hands after touching them. Irritants are substances that can irritate your airways and trigger asthma symptoms. Common irritants include tobacco smoke. Avoid smoking and secondhand smoke. Ask others not to smoke around you. Strong odors. Minimize your use of fragrances, perfumes, and strong cleaning supplies. Choose fragrance-free products whenever possible. Air pollution. Monitor air quality reports and limit your outdoor activities when air pollution levels are high. Changes in weather can also trigger asthma symptoms. Be prepared for cold air. Cold air can constrict your airways, making it harder to breathe. Wear a scarf over your mouth and nose when you're outside in cold weather. Humidity. High humidity can increase mold growth, while low humidity can dry out your airways. Use a dehumidifier or humidifier to maintain optimal humidity levels in your home. For some people, exercise can trigger asthma symptoms, a condition known as exercise-induced bronchoconstriction, EIB. However, with proper management, you can still enjoy physical activity. Warm up. Warm up your lungs before exercising with gentle stretches and breathing exercises. Choose the right environment. Avoid exercising outdoors in cold or polluted air. Consider indoor activities during these times. Diagnosing asthma involves a combination of medical history, physical examination, and specific tests to assess your lung function. Medical history. Your doctor will ask about your symptoms, how often you experience them, what triggers them, and whether you have a family history of asthma or allergies. Physical examination. Your doctor will listen to your lungs with a stethoscope to check for wheezing or other abnormal sounds. Lung function tests. These tests measure how well your lungs are working. Common lung function tests include spirometry. This test measures how much air you can exhale and how quickly you can exhale it. Peak flow measurement. This test measures how fast you can exhale air. it can be used to monitor your asthma control at home. Allergy testing. If your doctor suspects that allergies are contributing to your asthma, they may recommend allergy testing to identify specific allergens. Effective asthma management is essential for controlling your symptoms and living a normal, active life. The cornerstone of asthma management is developing and following an asthma action plan. Develop an asthma action plan. This is a written plan that outlines your medication regimen, identifies your triggers, and provides guidelines for monitoring your symptoms and peak flow. Medication regimen. Your action plan will specify which medications you need to take, how often to take them, and when to adjust your dosage. Trigger identification. Your action plan will list your specific triggers and strategies for avoiding them. Symptom monitoring. Your action plan will provide guidelines for tracking your symptoms and peak flow readings and when to seek medical attention. Use medication as prescribed. It's crucial to take your asthma medications exactly as prescribed by your doctor. There are two main types of asthma medications. Long-term control medications. These medications are taken daily to reduce inflammation in your airways and prevent asthma symptoms. Quick relief medications. These medications, also known as rescue inhalers, are used to quickly relieve acute asthma symptoms like wheezing, coughing, and shortness of breath. Identify and avoid triggers. Regularly review your asthma action plan and adjust it as needed to reflect any changes in your triggers or symptoms. Monitor your symptoms. Keep track of your symptoms and peak flow readings. This will help you identify trends and adjust your medication as needed. Stay active. Regular physical activity can improve your lung function and overall health. Talk to your doctor about safe exercises for people with asthma. Educate yourself and others. Learn as much as you can about asthma and share your asthma action plan with your family, friends, and coworkers so they know how to help you in case of an emergency. Living with asthma can present challenges, but with the right knowledge, tools, and support, you can manage your condition and live a full and active life. Stay informed. Keep up to date on the latest asthma research and treatment options. Connect with support groups. Join a support group for people with asthma. Sharing your experiences with others can provide emotional support and practical advice. Practice stress management. Stress can trigger asthma symptoms. Practice relaxation techniques like deep breathing, meditation, or yoga to manage stress. Regular checkups. See your doctor regularly for checkups to monitor your asthma control and adjust your treatment plan as needed. Prepare for emergencies. Always keep your quick relief inhaler readily accessible and inform others about your asthma and how to help you in case of an emergency. Understanding asthma is the first step towards taking control of your health and breathing easier. By learning about the causes, symptoms, and triggers of asthma, and by developing and following an effective asthma action plan, you can manage your condition and live a healthier, more active life. Now it's your turn. Talk to your doctor. If you suspect you have asthma, schedule an appointment with your doctor for diagnosis and treatment. Create an asthma action plan. Work with your doctor to develop a personalized asthma action plan that outlines your medication regimen, identifies your triggers, and provides guidelines for managing your symptoms. Share this video. Help spread awareness about asthma by sharing this video with your friends, family, and community. Together, we can empower others to breathe easier and live healthier lives.